The Upper East region has a population of over 1 million, and out of its 15 municipalities and districts, only 7 have hospitals, with the Bogatanga Regional Hospital serving as a referral hospital. Even though the 7 hospitals have at least a doctor each, the Bogatanga Regional Hospital bears the brunt of providing both primary and secondary healthcare services. The region has only 39 medical doctors, 721 midwives, 9 specialists, and 2 dental doctors, which is woefully inadequate for quality healthcare delivery. Residents in the region are not too happy about the quality of service delivery the Bogatanga Regional Hospital offers.
When you go to the regional hospital, in fact, I don't know how many doctors we have over there, but sometimes when you go there, at the end, your sickness even increases, because you go there and you sit in the queue for hours and hours just to see one doctor. Sometimes you say it's one doctor that is inside there. You sit down and you become tired. Sometimes you are even in pain, but the doctors are not there. What is even more annoying is that you might even sit there for about 2 hours. They get to a time the doctor said, "Oh, me, I'm done for the day. I'm going." The next person will come and take over, and you are on the queue, suffering, and the person is just gone like that.
I went there with my kid brother. Myself and him were all not well. We went there, were able to access the OPD. And when we got to the consulting room, they were not there to take care of us. So we had to go home and come back the next day. Yeah. So I think the doctors, they are not trying for us.
I think that we have fewer doctors, and that is a doctor-patient ratio in the region. And so when you go there, it takes a long time. I remember sometime I went there, I had to sit for almost 3 hours. And even the time, the opportunity I got to see the doctor, he was also out for other activities, I think like surgery. So I actually delayed there.
Dr. Sanwia Aiden is the medical director of the Bogatanga Regional Hospital and says inadequate doctors must be addressed to solve the challenge.
All the specialized services, eye care, orthopedic surgical specialty, general medicine, pediatrics, and obstetrics and gynecology. And we believe that all these critical services require human resource, which is one of the things that we cannot, buy over time. So these are people who have to train and get on the job. For a regional hospital, the staff norm for a regional hospital of our nature is at least we need 40 medical officers to be at post. But currently we are operating with 11 medical officers. So that should tell you the situation. People are running their backs off. They work night shift and they have to continue during the daytime, and it's affecting the quality of work that they do.
In a bid to improve the doctor-patient ratio in the region, the Ghana Health Service posted 5 medical doctors in 2020 and 10 medical doctors in 2021 to the Upper East region, but they all refused to report to work. Upper East Regional Director of Health Services, Dr. Emmanuel Kofi Doche, tells City News why the doctors refused postings to the region.
As management, we have been trying to find out the major reasons why they are not coming. Some of them mentioned the fact that the Upper East region is far from where their families are, because some of them are in Accra, where they reside. So they realize that traveling up here, they find it difficult to go back to be seeing their families. And some also look at the fact that here, if they are working, there may not be any other alternatives in case they want to do what they call locum, that is getting additional income apart from what they receive every month. For accommodation, they complain of beds. We have put in some measures so that where they are posted to, we find alternative accommodation. So that is not really the problem.
He says the situation is negatively affecting healthcare delivery in the area.
If a doctor is posted here and is not able to come, we can redirect the person's salary to the region, so that when you come here, your salary is here, they will pay you. We should not encourage them to have access to work in other places. When we do that, then they are free to go to other places. But I think that also we need to be done in a form of negotiation, so that it doesn't become a punitive measure. That will also deter them.
Fascinated about local incentives put in place by the Regional Health Directorate to attract and retain doctors to the region, Upper East Regional Minister Stephen Yakubu wondered why newly posted doctors refuse to work in the region. Mr. Yakubu further hinted that his outfit is developing a long-term plan to train and retain doctors for the region.
The retention of the doctors still seems to be a problem. So we have to think through another innovation to try and make sure that we get doctors here. So luckily, Tedam University is going to be training doctors, and my intention, which I've already made it known to them and also to my MMDCs, that we should be planning to sponsor some of these doctors also in the district and then also in the municipalities, so that when they come back, we'll tie them, we'll bond them, and then when they come back, then they will be able to stay with us and work with us.
Reporting for City News, Frederick Aouni, Bobatanga.